Bill C-15 will not make illicit drugs less available in Canada. Instead, it will likely make illicit drug markets more appealing and lucrative to those who run, control, and benefit from them most: international drug production and importation syndicates, organized crimes, gangs. In fact, every politician supporting Bill C-15 and the prohibition apparatus at its base should expect appreciation from these entrepreneurs for maintaining and protecting these exceptionally lucrative markets. As has been aptly stated, drug prohibition laws are state-sponsoring laws for organized crime. While making illicit drug markets even more lucrative, they have the potential to become more volatile and violent than they already are. Undoubtedly, the inherent violence that comes with volatile and unregulated drug markets has spawned and fueled much of the recently observed gun violence in Canadian cities. Please be prepared to see these problems amplified and growing in the near future if drug prohibition is continued on its current path and expanded with tools like Bill C-15. Point number 5. Bill C-15 is diametrically opposed to public health principles and therefore constitutes bad policy by design aimed at the drug problem in Canada. As mentioned earlier, Bill C-15 is another component in the system of drug prohibition that is misdesigned and reinforcing ineffective, yet inherently and collaterally harmful policy directed at psychoactive drug use. Century-old prohibition system requires a fundamental overhaul based on acceptance of several elementary principles. These include the acceptance of the fact that the demand for psychoactive drugs will always exist. Many forms of psychoactive drug use can occur in ways that do not need to be burdened by extensive risks or harms. One example is recreational cannabis among adults. Cannabis use among adults, activity millions of Canadians actively engage in. So with other legal and state-sanctioned risk activities, whether it's gambling, parachuting, whitewater rafting, and so on, it is and should be the state's role to use education, prevention, legal regulation, and control to make these activities as safe, risk, and harm-free as possible, and to provide potentially needed and effective treatment or other rehabilitative interventions for those who, contrary to our best intentions, develop problems or dependence related to drug use. One essential role for the state in such a public health-oriented model would be a regulated, safe, and restricted availability system of psychoactive drugs to responsible consumers. A regulated and state-controlled cannabis supply model, for example, recently proposed by the widely endorsed Beckley Foundation's Global Cannabis Commission report, which I have co-authored, would quickly eliminate much of the economic lucrativeness for organized crime of currently illicit cannabis markets and hence reduce related volatility and violence. Would furthermore provide cannabis users with predictable, regulated cannabis products they can obtain under legal conditions. For drug users who suffer from chronic disease, like drug dependence or other serious diseases for which psychoactive drug use can offer symptom relief, the state ought to sincerely embrace the role and responsibility of a medical provider in instances where such interventions have shown to be beneficial for individual or community health. This includes medicinal cannabis programs far beyond the current highly constricted medical marijuana access program, as well as medical opiate maintenance programs far beyond current methadone treatment for those in need and suffering from opioid dependence, and may need to be extended to medical stimulant prescription where therapeutically indicated. Honorable Senators, in sum, Bill C-15 is bad legislation, needs to be stopped. The anachronistic complex of drug prohibition sitting at its foundation needs to be fundamentally overhauled and replaced with good, sensible, and evidence-based public policy guided by public health. Bill C-15 stands in categorical opposition to those principles. Thank you for your attention.
Thank you very much, Dr. Fischer.